Niceville, Florida. Well, that is very nice. Welcome, Niceville, Florida. All right. Well, thank you all for joining us for this coffee chat session. For those that are joining us for the first time, this is a new series that we're holding monthly on the first of the month through the end of this year. And I'm Lori Sjogren, and I'll be assisting with today's session. And as just a few more housekeeping notes, closed captioning is available for today's session. So to enable closed captioning, you just click on the closed captioning button, and that's found on the bottom of your screen. And also, just wanted to let everyone know that this coffee chat series is designed to be an open Q&A. Today, we have a special guest speaker, Kathleen Parker, joining us. But during the open Q&A portion of even today's session, that part will not be recorded. Also for questions, all questions for either Kathleen or Kristin can be typed in the chat, or you can use your hands raised tool and we'll unmute you and answer questions as time allows. But since we are in Zoom meeting, if you are not speaking, if you could keep yourself muted to reduce any background noise, that would be truly appreciated. So now I'm excited to welcome our resident coffee chat facilitator, Dr. Kristin Barañano, who is a pediatric neurologist at Johns Hopkins Ataxia Center, and our special guest speaker, Kathleen Parker, who is a neuropsychologist at Kennedy Krieger. Welcome, Drs. Barañano and Parker.
Oh, great. Thanks so much. For those of you I haven't gotten the chance to say hi to, I'm Kristin. I live in Baltimore, Maryland. So I'm a child neurologist and neurogeneticist, and I'm the child neurologist for our multidisciplinary pediatric ataxia and cerebellar disorders clinic at Kennedy Krieger. So I have the great honor and privilege of taking care of a number of kids with ataxia.
And I'm Kathleen Parker, so I'm one of the neuropsychologists here at Kennedy Krieger. And so with neuropsychology, we have various different specialties. So the main population of children that I see here at Kennedy Krieger are those in our congenital genetics clinic. And then I also see students in our concussion multidisciplinary clinic. But just to give you guys, or is it my turn to give the overview of neuropsych? Okay.
We'll give a little intro. So
sorry.
when we met for our first meeting last month, the subject of neuropsychological testing came up and how it can be super important and helpful. And so we wanted to invite Kathleen as a guest speaker to provide just a kind of a brief overview of neuropsychology and what neuropsychological evaluations are about, and then kind of open it up to any questions, because it seemed like there was a lot of interest about this last month.
Sure. So yes, neuropsychological testing in general can be very, very valuable for a variety of different reasons. Specific to disorders related to ataxia, we can have genetic disorders that cause that. We can have brain malformations. We can have traumatic brain injury, metabolic disorders. All different kinds of medical issues can have ataxia as a symptom. And with neuropsychological testing, that spans really looking at a variety of different brain functioning domains to work with the medical team, to work with families, so that they can work with their schools in order to provide more comprehensive care. So a lot of the times neuropsychological evaluations can be pretty lengthy. So for some sites, we'll have a student come in with their families and we'll do an interview on one day just to give us an idea of maybe what the questions or concerns are. Sometimes if the question or referral is from a medical provider, it could be related to a student struggling at school. It could be related to maybe concerns about like behavioral functioning that could be related to, you know, an underlying like behavioral or mood disorder. Maybe there's a concern about a change in functioning. So particularly when we have students who have suffered a traumatic brain injury, or we have students who have tumors and have like, you know, residual issues related to like treatment or resection, then we'll see them for kind of like repeat evaluations, kind of to track their progress and inform recommendations. But really, recommendations kind of span anything from like school accommodations. So I don't know if you guys are familiar with like a 504 plan or an individualized education program. So helping formulate like additional goals or accommodations that we think would be helpful, working with the medical team. So sometimes they want to know if there is like data to support a change in functioning or an improvement in functioning based off of maybe changes in medication or treatment that they decided to pursue. Sometimes it's just like helpful for parents to know if there's like anything underlying the problem areas or areas of concern and what they can do in the home environment or in the community to help their child be the most successful, and to support them. Just in terms of like exactly what a neuropsychological evaluation entails. So I think I kind of alluded to like we'll do an interview to really get a good idea of what the referral question is. And then either that same day or depending on what site you go to, a different day, testing takes place. And so it's like different than a medical provider's evaluation in that we don't do any like shots or needles or anything like that. It involves either paper and pencil tasks, verbal tasks, some motor tasks, memory tasks, again, spanning various areas of cognitive functioning. So we do look at things like intellectual functioning, we'll look at attention, a lot of those conditions that I talked about that can result or have ataxia as a symptom will impact attention. Executive functioning. So this is a big umbrella term for our brain's ability to think about thinking. So it deals with things like planning, problem solving, initiating tasks, organization, but it also deals with things like being able to regulate our behaviors, regulate our emotional responses. So we have measures and questionnaires that span that area. We also look at memory. A lot of the times with different conditions, memory is impacted. So verbal and nonverbal memory. We also look at kind of how students are able to learn that information, what their learning profile looks like when we have them memorize information. We can screen academic skills if they're concerned about academic skills. And we'll a lot of the times look at, you know, fine motor functioning, really tying into how the pattern of strengths and weaknesses lines up with either like the genetic condition or the part of the brain that we're worried about being involved in, you know, whatever caused like the medical reason why this child is seeing the medical providers. So the testing portion can last, you know, one day. It may be broken up into several days. And then like the last piece of a neuropsychological evaluation is really a feedback session. Typically that's on a separate day. Or if the family has it within them, we'll do it at the end of a testing day. And that goes over like all the data. So we gather data from like the paper and pencil and verbal and motor tasks that we do with the student, but we also get a lot of collateral information. So like information from parents, caregivers, through questionnaires, through the interview. We also ask for like teacher ratings. If teacher input isn't available, then we ask for just like a secondary informant. So that could be like a coach or a tutor or a therapist that works with the student. We combine all of that data together to look at really a pattern of strengths and weaknesses and how that ties together and if it fits with a diagnostic profile. So whether that's, you know, underlying ADHD, it could be like a mood disorder like anxiety or depression. It could be a learning difficulty, so something like a specific learning disorder, or something a little bit more pervasive in terms of like an intellectual disability, where maybe overall our functioning is significantly below where we would be expected to be functioning based off of our age and grade level. So we take all of that data together, and then we'll talk about any diagnoses that we made based off of that data, and then we'll talk about recommendations. So sometimes we'll talk about like recommendations in terms of if we think like speech therapy, occupational therapy, or physical therapy would be helpful, or maybe if there's already physical therapy, occupational therapy, and speech therapy, maybe we think that like it would be helpful to have like an increase in number of sessions, or increase in like supports at school related to those like fine motor, gross motor, or language concerns. Sometimes we may suggest like a change in medication. So for example, with ADHD, we may have like lingering symptoms based off of the data. So we'll kind of have the family, or suggest that the family talk to their medical team about maybe we need to tweak the medications. That's an example of what may happen based off of the results. And then a big chunk of the recommendations deals with school and accommodations, and what is in place, what we think might be helpful to have in addition to that. And then there's also a piece that we talk about in terms of like school, like how to support your student, or sorry, at home, how to support your student at home in terms of like if there's academic weaknesses, attention weaknesses, memory weaknesses. And then usually we also will talk about like additional recommendations in terms of like resources in the community that we think would be helpful for families. I know that's a lot of information. I don't know if Kristin or Laura, if you have like specific questions that you think the group would want me to like talk further about, or if you want to just open it up to whoever has specific questions.
Well, that was great information, Kathleen. I think one of a question that came to mind when you were talking about the evaluation, which I thought that was a great explanation of the evaluation process and then the follow-up. With a progressive disease like ataxia, does it lead to reevaluations?
So typically, like depending on like the medical condition that we're seeing, sometimes we'll reevaluate like every 6 months. Sometimes it's like every year. For some of our students who are more stable, it's like every 2 to 3 years. So yes, it definitely depends, especially if it's more progressive. Then we'll follow a lot closer, just because we want to see gains, or if there is like a decline in functioning, we want to be able to communicate that with the team and make recommendations and accommodations as needed.
Great, makes a lot of sense.
Mhm.
So I think it might be helpful just to give some, like, I know you touched on this already, but just some concrete examples of like diagnoses that might come out of a neuropsychological evaluation that might be helpful to families to hear.
Sure. So I had mentioned one like big one that comes out a lot of the times is ADHD. If we're concerned about underlying attention problems, specific learning disorders, so something like dyslexia or dysgraphia or dyscalculia, or like the alternate names for that is like a specific learning disorder in reading, a specific learning disorder in math, or a specific learning disorder in written expression. Intellectual disability is also something that can commonly come out of a neuropsychological evaluation results, as well as like behavioral or mood disorders. So like anxiety disorder, depressive disorder, behavioral conditions like conduct disorder or oppositional defiant disorder. That information can also be gathered from a neuropsychological evaluation. And then like depending on like the genetic condition, or the part of the brain that's impacted by whatever medical condition a child has, we can also kind of compare like a typical profile and see if like that pattern of strengths and weaknesses lines up with that. So, like for example, let's see if I can give like in spina bifida, there's a very specific profile of like visual spatial related weaknesses, like attention weaknesses, executive functioning weaknesses. Like, for example, so we can say if, this pattern of strengths and weaknesses, like that's consistent with what we see in this population of students, and like your child is like pretty similar to that. So sometimes that's like helpful for families to know as well.
Great. Thank you so much, Kathleen. I think it might be helpful. I guess we could probably stop recording now, Lori, if we're still
Yep.
recording. Maybe